In your work related to vaccines, how many fetuses have been part of that work?
My own personal work, 2.
2. So in all of your work related to vaccines throughout your whole career, you've only ever worked with 2 fetuses?
In terms of making vaccines, yes.
I'm going to hand you what's been marked Plaintiff's Exhibit 41. Okay. Are you familiar with this article, Dr. Plotkine?
Yes.
Okay. Are you listed as an author on this article?
Yes.
Okay. This study took place at the Wistar Institute, correct?
Yes.
You were at the Wistar Institute, correct?
Yes.
How many fetuses were used in the study described in this article?
Quite a few, but my answer to the previous question was, what did I use to make vaccines?
So I'm going to ask that question again. In your work related to vaccines, how many fetuses were involved in that work?
There were only 2 fetuses involved in making vaccines. When fetal strains, fibroblast strains, were first developed, I was involved in that work trying to characterize those cells, but they were not used to make vaccines.
Wasn't the purpose of this study to help develop a human cell line or to support the use of human cell lines in the creation of vaccines?
The idea was to study the cell strains from fetuses to determine whether or not they could be used to make vaccines.
Okay. So this was related to your work?
Well, yes, in a sense,
to
yes.
vaccines, correct?
Yes. It was preparatory.
Okay. So this study involved 74 fetuses, correct?
I don't remember exactly how many.
Turn to page 12 of the study.
Yeah, 76.
76.
Mm-hmm.
And these fetuses were all 3 months or older when aborted, correct?
Yes.
Okay. And these were all normally developed fetuses, correct?
Yes.
Okay. These included fetuses that were aborted for social and psychiatric reasons, correct?
Correct.
What organs did you harvest from these fetuses?
Well, I didn't personally harvest any, but a whole range of tissues were harvested by co-workers.
Okay. And these pieces were then cut up into little pieces, right?
Yes.
And they were cultured?
Yes.
Okay. Some of the pieces of the fetuses were pituitary gland that were chopped up into pieces to okay, included the lung of the fetuses?
Yes.
Okay, included the skin?
Yes.
Kidney?
Yes.
Spleen?
Yes.
Heart?
Yes.
Okay. And tongue?
I don't recall, but yeah, probably yes.
So I just want to make sure I understand. In your entire career, and this was just one study, so I'm going to ask you again. In your entire career, how many fetuses have you worked with?
Well, I don't remember the exact number, but quite a few when we were studying them originally, before we decided to use them to make vaccines.
Do you have any sense? I mean, this one study had 76. How many other studies did you have that you used aborted fetuses for?
Oh, I don't remember how many.
You're aware? Are you aware that one of the objections to vaccination by the plaintiff in this case is the inclusion of aborted fetal tissue in the development of vaccines and the fact that it's actually part of the ingredients of vaccines?
Yeah, I'm aware of those objections. The Catholic Church has actually issued a document on that which says that individuals who need the vaccine should receive the vaccines regardless of the fact, and that I think it implies that I am the individual who will go to hell because of the use of aborted tissues, which I am glad to do.
In any event, so we have 76 in this study. Would you approximate it's been a few hundred fetuses?
Oh, no, I don't think it was that many.
Okay.
It was probably not many more than in this paper.